Hi everyone, Lara here, and today I will be presenting on lung cancer. First thing we want to do is identify the lungs. The lungs are the primary organs of the respiratory system. They lie above the diaphragm and below the sternum, and on either side of the chest or thorax. Their function is to extract oxygen from the atmosphere and transfer it into the bloodstream, and to release carbon dioxide from the bloodstream and into the atmosphere in a process called gas exchange. Now that we know what the lungs are and their function, let's look at lung cancer. Lung cancer, also known as lung carcinoma, begins at the lungs and most often occurs in people who smoke. If left untreated, this uncontrolled growth can spread beyond the lungs into nearby tissues by a process called metastasis. Lung cancer has three main forms. One thing to note is that the two types of lung cancer which grow and spread differently are small cell lung cancers and non-small cell lung cancers. Non-small cell lung cancer is the most common and makes up for 85% of the lung cancers. It has three subcategories. Adenocarcinoma is glandular in appearance, tends to grow slower than the other types, and is the most common among non-smokers. It also accounts for 40% of lung cancers and more common in women than in men. Squamous cell carcinoma, also known as epidermoid carcinoma, is large and flat in appearance. It accounts for 25 to 30% of lung cancers, often linked to smoking, and found to form in the central area of the lung. Large cell carcinoma is highly undifferentiated or immature in appearance, making it unrecognizable. It tends to spread quickly, making it harder to treat. It accounts for 10 to 15% of lung cancers, and it is found to form in any part of the lung. Small cell lung cancer, also known as oat cell carcinoma, makes up 10 to 15% of the lung cancer forms. It is commonly located at the center of the lung, and this form of lung cancer is almost entirely related to heavy smokers. Lung carcinoid tumor, also called lung carcinoids, make up 5% of the forms of lung cancer. Between the two appearances, atypical is more aggressive, with a tendency for distant metastasis and recurrence. There are three possible tests that can be used to diagnose lung cancer. Note that with tissue sampling, there are several ways to perform a biopsy, such as bronchoscopy, mediastinoscopy, or needle biopsy, all terms that we have learned in this class. As stated earlier, there are two forms of lung cancer that grow and spread differently. Here is the breakdown of the stages between non-small cell lung cancer and small cell lung cancer. As you can see, there are various symptoms that are linked to lung cancer. However, these symptoms typically do not present themselves in the earliest stages. Usually, they occur when the disease is already advanced. There are several risk factors that increase the chance for cancer. Some can be controlled, such as quitting smoking, while others cannot, such as a family history. In terms of treatment, the doctor chooses a cancer treatment plan based on a number of factors, such as the patient's overall health, the type and stage of the cancer, and the patient's preferences. Some treatments can be used simultaneously. Lastly, let us look at some key statistics. Lung cancer mainly occurs in the elderly population, where 2 out of 3 diagnosed are 65 years or older. The general prognosis of lung cancer is poor because doctors tend not to find the cancer until it is at an advanced stage. 5-year survival is around 54% for early stage lung cancer that is localized in the lungs. But in the advanced, inoperable stage, the survival rate is only 4%. This is why there is a much need for research and funding for lung cancer research in order to find better early detection interventions and possibly a cure. This concludes my presentation. Thank you for watching, and I hope that you all learned something new.